My name is George Smith, and I'm intern at the UT Health Medical and Research Center, and I'm going over the studies of lower back pain and overhead sports. Lower back pain is one of the most common types of injuries affecting the spine. It's most often associated due to lack of physical activity and long periods of sitting, but can also be due to overloading on the spine. Although research is limited, lower back pain has also been shown to be linked to the participation in overhand sports. Sports such as volleyball, baseball, tennis, and swimming are all considered overhand sports, and the main reason lower back pain would be associated with overhand sports is due to the excessive trunk extension and overuse of the lower back. Causes of lower back pain in overhead sports could be due when players pick up any sport and are unsure of how to do the correct motions and movements. So, for example, I'm going to be doing the incorrect and correct motions of serving a volleyball over the net. As you can see, during the incorrect movement, I'm doing an excessive lumbar extension when swinging the ball across. This, over a long period of time, can develop lower back pain. But during the correct movements, as you can see, I'm just swinging my arm through. There's no excessive lumbar extension, and everything's looking fine and normal. When diagnosing for lower back pain, the provider will examine for unusual curves of the spine, a tilt of the pelvis, and tilting of the shoulders. Muscle strain and reflexes will also be tested, followed by ongoing special tests and movements such as the hip extension test, knee bending test, and forward bending test. Questions that can be asked during a physical examination could be: when was the onset of pain? Do you have a history of said sport injury? When was the pain exacerbated? And did you start any new habits? These questions can help pinpoint the root of the pain and give the examiner a better idea of the following actions that cause the back pain over time. After a successful diagnosis, treatment should be started by doing manual therapy, ice and or heat treatment, kinesio taping, electrical stimulation, ultrasound and stretching and straightening. In February 2017, an article was published titled "Lower Back Pain in the Overhead Athletes, Evaluation and Treatment Based on Movement System." The objective was to present functional evaluation and a therapeutic approach on the movement system in the case of lower back pain. The study included a 26-year-old male with complaints of chronic mechanical lower back pain due to sports activity in volleyball. During the patient's physical examination, the patient had a deficit of lumbar motor control and extension and pelvic rotation and functional alterations in muscles. The patient went through a therapy program for 4 months which focused on spinal motor control training. During the physical examination, the patient reported a pain intensity of a level 4 on an NRS scale. The patient underwent functional tests to determine the influence of pain on specific movement as well as the quality of movements. During the test, the patient had 5 different tests, such as the forward bending test, hip extension test while standing, hip extension test in quadruped, small knee bending test, and lastly the hip adduction test in supine. During the first half of therapy, sessions were held once a week, with the latter being 1 session per 2 weeks. The patient had also received a home exercise program to perform at home. The first stage focused on was educating the patient on holding a pelvic neutral position in the sagittal plane, following with active correction of pelvic alignment in a neutral position. The next stage was the progression of exercises and raising the intensity by incorporating body mass load and external loads. And afterwards, once the patient adjusts to the exercises, sport-related exercises were incorporated, such as the upward vertical jump and ball serving in volleyball, with a mental notice to avoid excessive lumbar extension and rotation. Exercises were also included to increase the muscle performance of the abdominal oblique muscles, gluteus maximus, and gluteus medius, focusing on using isometric works to demand isometric muscle tensions. After 4 months of physical therapy, a re-examination was conducted. During the re-examination, the patient reported a lower pain intensity on a scale of 1 to 2 in the NRS scale. He experiences no pain increase after volleyball training, although pain was increased after prolonged prone lying, which the patient is avoiding. During the special test, smaller anterior pelvic tilt and a lower lumbar lordosis was noticed, along with an increased motion quality, lumbar spine extension, and lumbar rotation. Lastly, the patient had significant improvement in the abdominal muscles and gluteus maximus, but with functional insufficiency in the gluteus medius. In conclusion, the movement system is a useful tool for functional evaluation in mechanical lower back pain in older athletes, which links symptoms of movement mechanics and motor control alterations, and that the therapeutic approach on the movement system is an effective strategy with developing treatment.